there are other people out there who understand this context, who live this context within the HSE every day. It made me feel less lonely in that, and it showed me that there are other people who are like-minded.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we are talking about cultural diversity from a HSE staffing point of view. We have 3 guests with us today, 2 members of the HSE Cultural Diversity Network, Christopher Ibanga. Welcome, Christopher.
Thank you.
And Abbie Alcorn.
Thanks very much.
And we also welcome Maria Barry from HSE HR, where she works to support this and other staff networks that support diversity, equality and inclusion in the HSE. Maria, very welcome to the podcast.
Thanks, Fergal.
So Maria, let's start with you. You're working in HSE HR. What's the purpose and the background to the Cultural Diversity Network?
So I'm a diversity, equality and inclusion manager in the HSE. So key part of my role is managing and looking after the Cultural Diversity Network. So the network was set up, I think, back in 2023, and it's a network for all HSE staff. It's a place where staff from diverse cultural backgrounds can come together, share their personal experience, share insights and maybe about their cultural backgrounds, tips for how they've maybe integrated into Ireland, into the HSE. So it's really a forum where staff can come together in a safe space and have those conversations. So it's been hugely successful since it was established. There's a couple of hundred members in the network at the moment from all types of cultural backgrounds. The network itself, they meet every 2 months virtually online for about an hour and a half. So since the network was established, members have helped the diversity, equality and inclusion team with developing guidance on cultural topics, on raising awareness about diversity and inclusion issues to the workforce, and really just promoting the importance of cultural awareness and cultural diversity in the HSE. So it's been a huge asset to all staff from all cultural backgrounds. And also it's open to anyone that just has a general interest in the topic and wants to find out more about cultural diversity.
Yes. And there's such a dependence on cultural diversity from a HSE staffing and workforce point of view. Biggest organisation in the state. There's a dependence on it to be able to meet the needs of a growing, diverse population in Ireland. Isn't that right?
Yeah. I mean, if you look at the makeup of the HSE workforce now, almost 1 in 5 of the entire workforce is from countries outside of Ireland. That spread looks different across medical and nursing as well. So we're particularly reliant on staff that have maybe trained internationally and have international experience to come into the HSE and deliver our services. Yeah, it's really reflective of the diversity in society that we're seeing now. It's hugely important for the HSE to embrace that cultural diversity and make sure that we're all gaining from the richness of our experiences abroad in other countries and bringing that to benefit our service users.
Yeah. So Christopher, coming to you first here. So how long are you on the network and what do you get out of that?
I've been on the network since 2023. It's really, really beneficial for me because it's an avenue for me to chat with other internationally educated healthcare practitioners from around the world and gain insight into their cultural backgrounds and also promote my own cultural identity towards them. And we share ideas on how to navigate this diverse cultural workplace that we find ourselves in Ireland.
So tell us a bit about your own background then. You're from Africa?
Yes, from Nigeria. Originally, I was born in Nigeria and I trained in Nigeria as a nurse. I graduated from nursing school 35 years ago, practiced nursing in Nigeria, practiced in Rwanda as a volunteer for 2 years, worked in Bermuda for 5 years, and then went back to Nigeria to work with World Health Organization in the community, and then came to Ireland in 2017. So since 2017, I've been here in Ireland, working as a nurse first in a nursing home and then joining the HSE in 2021 as a health protection nurse.
So you're working in public health as a health protection nurse. Where are you based yourself now?
My office is Dr. Stephen's Hospital in Dublin 8. I work with the Department of Public Health for Dublin and Midlands.
Very good. So how have you found that experience of working up into the HSE?
It is very, very enriching and very satisfying. I've always loved public health. So even when I came to Ireland, I was just working in the nursing home trying to look for a public health job.
Okay.
Because I feel prevention is better than cure.
Yeah.
So even while I was in the hospital setting, I still feel that most of the disease conditions can be prevented. So I'd prefer to be part of the prevention team.
Okay, great. Thank you. Abbie, can I bring some of those same questions to you? In terms of the network, first of all, what has it meant to you?
Yeah, I joined in 2023 as well. For me, as an allied health professional, I'm a senior speech and language therapist. Our profession is very female dominated and very white dominated as well. I don't actually know of any other person of colour in Ireland within the profession. So I found it quite a lonely experience from that aspect, despite being very fulfilled in my job itself. So when I discovered about the HSE Cultural Diversity Network, I was so excited, first and foremost, to join the first meeting. For me, the visibility, when I switched on the meeting and saw the Zoom call and all the different faces from different places, different cultural backgrounds, for me, it was really just a sense of there are other people out there who understand this context, who live this context within the HSE every day. It made me feel less lonely in that, and it showed me that there are other people who are like-minded. We learn from each other's perspectives, each other's backgrounds, and we often break out into smaller groups within the overall Zoom meeting and discuss ideas and topics with each other and then feed back to the main group. And it's just been very enriching for me and given me a community that I can't find within my own profession.
Yeah, very well put. So let me ask you about your own profile then, in the same way that Christopher, can you tell us about your own background?
So I'm of mixed race heritage. My mother is white Irish and my father is from Sierra Leone, which is a country in West Africa. I was born in Cambridge. We moved to Sierra Leone when I was 2.5 and planned to live there for the duration of our life. But unfortunately, there was a civil war, which then led us to moving to Ireland quite quickly when I was about 5.5. Now, my mother is Irish. I had family here. It wasn't difficult for us in that sense, but it was a huge upheaval. I've lived in Ireland ever since, and I'm married to a man from Northern Ireland, and we have 2 small children. My context has largely been within Ireland, despite having visited Sierra Leone on a number of occasions since we've left. But the older I get, the more I see that despite my main life experience being here, for a lot of white Irish people, I'm seen as very other or different.
Yeah, there's so many similarities, and I guess you probably get this through the Cultural Diversity Network. There's so many different contexts, but from having a mother that's white Irish and a father that's Sierra Leonean, there is a risk that you could be othered by both communities.
Absolutely. Because I had started my schooling in Sierra Leone and I was speaking one of the tribal languages quite fluently, I was speaking Kissi. My memory of living there was really of belonging, of being just a part of that community. And so the first time I went back after the war was finished when I was about 16, I was so excited to go back into that culture and feel like, yes, this is, I had all my memories from it, and really found a culture shock when I went there because I was very much viewed by the people there as being white and as if I didn't belong. That was very difficult for me to reckon with because for my own identity, it showed me that there is no specific space where I will fully belong. There needs to be a level of acceptance within myself then for that. Over time, it's been good for my own self-worth and my own self-identity and growth because it's enabled me to just come to a place where I'm comfortable with myself as I am. Dual heritage, I'm Sierra Leonean and I am Irish. In the work context, what I find is that sometimes I really need to lean into my Irishness to make other people feel more comfortable. And what does that do for me and for my sense of self? Yeah. That's why I really feel like this topic is so important for everybody to hear.
Leaning into your Irishness. Yeah, that's interesting. So you are Irish. Christopher, you're Irish now. You've got Irish citizenship as well.
Yes, I got Irish citizenship in 2023, but it's still very difficult to let people know I'm Irish because when they hear my accent, a lot of people know I'm not Irish. Yes, they say, oh, you're a Nigerian, and they see my color, I'm black. They say, oh, you're an African. So it's a difficult terrain to navigate because you're trying to work and trying to encourage people to be open to you, and you're trying to be open to people. But sometimes when they hear your name or they hear your accent, the walls go up and they start to question, am I talking to the right person? In my line of work, most of my work is done over the phone. I'm not facing anybody except on very, very serious occasions. So when you call somebody on phone trying to do your work, when they hear your accent, at first they were trying to be nice, but later they said, who are you? And you introduce yourself again and again. They say, why are you calling me? And you tell them why you are calling. They say, okay, I don't want to talk to you now. So it's kind of an experience that I've lived with, but I feel we continue to talk about it, that Ireland has changed. It's going to keep changing because the demographic parameters in Ireland now has changed. A lot of people from other countries are here, health workers, construction workers, teachers. So obviously, even in the health service, we have a lot of people from other countries who are internationally educated, and we will continue to be increasing day by day. So it's a high time we continue to talk about it so that Irish people will know that we are here to help and we are here to work. It is very, very important. In fact, I had an experience, somebody, when the person heard my voice, he said, "Are you sure you are not scamming me with this call?" So sometimes people feel, okay, because you sound like a Nigerian, you are a scammer. Nigeria is a country of 200 million people, and not everybody is a scammer in Nigeria. And every country have their bad boys and bad girls. So obviously, we have to keep talking about it.
Yeah. So there's preconceived notions and there's biases that people have.
Just to jump in on that, because we had a previous call, myself and Christopher found that we both go through that invisible barrier. And as Christopher just explained there, for him, it's on the phone. And I think that there's a discomfort for white Irish people to hear these conversations. Understandably, there are a lot of people who have good intention and they don't want to believe that about our society. And Ireland is known as being the country of Céad Míle Fáilte, 100,000 welcomes. And for me, I'm starting to discover that maybe, and this is very uncomfortable for people to hear, but maybe that's for a specific profile. Maybe there's 100,000 welcomes if you fit into a specific profile. And when we hear something that's uncomfortable, we try to excuse it away. Well, maybe people are just more elderly, maybe they don't fully understand, maybe they just are curious, maybe they're just interested. But actually, we need to hear the truth and believe people's lived experiences. To attest to what Christopher is saying, when I was working in community care, I'm currently in the hospital setting, but in community care, you often would go into people's homes for appointments, you'd bring people into clinic, and oftentimes I would have a phone call before to gain a little bit more information on the client and to just build a little bit of rapport and arrange the appointment. There's no issue on the phone. I have an Irish accent. There's absolutely no issue. We build good rapport. Everything is fine. Then comes the day of the appointment. They walk into the waiting room and they see me. That's when they see the colour. For Christopher, he's immediately facing a barrier. As soon as I'm seen, I'm then facing that barrier. And what's the difference there? The difference is seeing the colour.
Yeah.
That's when I have to jump through hoops in order to then rebuild that rapport, bring it back. Something like that is so important, for that client therapeutic relationship and to your outcomes. I've been to people's homes where as soon as they've seen me, there's a huge mistrust, just nervousness at me being in their home, which is their vulnerable space. And I have to break that barrier before I can even start to care for someone. And people have to understand in a caregiving profession, you're in this profession to help. And you have to stretch yourself and prove your worthiness in order to help someone. Something that people need to hear about, as uncomfortable as it is. And I don't think it's right that people like myself and people like Christopher have to prove our worthiness to work. We've done our qualifications, we've done our training, we keep up our CPD, we've interviewed, we've been hired into the post. There needs to be an openness to working with people who are not from your cultural background.
That's just put simply, but there's huge context behind that. That's very well put. I'd have to agree with you. We are uncomfortable hearing that. Maria, that's part of the challenge we're facing here, isn't it? Trying to spread cultural diversity within the whole staff network, but also in the public realm in Ireland. It is an issue, isn't it?
Yeah, you mentioned there earlier biases and assumptions, and that's a key thing that we see in the diversity and equality and inclusion team. We work across a broad range of staff, so cultural diversity, disability, supporting LGBTQIA plus staff and other diversity grounds. So a key challenge we see across a lot of diversity grounds is people's biases and assumptions, these notions that maybe when they hear someone's voice or see someone's skin colour that they're not qualified enough. They may have a particular job based on their skin colour. So all these biases and assumptions come out and they're really based on very little evidence. Often people as well are maybe afraid to say the wrong thing and afraid to ask questions. A lot of these biases can be probably dismissed and dealt with if people were comfortable just asking their colleagues about their background, not being afraid to say the wrong thing as well. I've been in diversity, equality and inclusion for the last number of years and I'm still learning as well. So it is a very evolving landscape in terms of how we communicate about diversity, the language we use, the terminology. And I'm constantly learning as well about my work colleagues, even from the conversations in the Cultural Diversity Network. So the thing is, it's a journey. Your knowledge about cultural diversities could continue to grow. And the more open we are about asking your colleagues maybe their preferences around how they like to be described, what kind of language they use around their backgrounds in Cultural Diversity Network. It's something we need to be less fearful of.
One of the key points is that you said there has to be an openness to continuous learning, because my own perception, one of my first jobs in the health board, Midland Health Board as it was at the time, was around traveller health and delivering cultural diversity training around travellers, with travellers, to health board staff. And every day I'd come away worn out from listening to the discriminatory attitude to travellers. You'd have settled white Irish people saying, I'm not racist, but like I don't like travellers. That was okay to be racist towards travellers. And knowing that that exists in Irish society and being faced with it from your own colleagues, it was a bit soul destroying. These are colleagues in the health service, and to think that that's there. So that openness to learning, I think that's a key point. It is absolutely a journey.
It's a journey without an end. There's no destination, but we just believe that we're going to get there at some point, because unless you start the journey, you might not know even where you are going.
Yeah.
So I think it's high time we start this journey. Let everybody in Ireland know that we are in this journey. We are not going backward. We keep going forward, because Ireland has changed and is continuing to change and will continue to change. The multicultural nature of this country is going to be increasing, because at the end of the day, nobody is totally independent. We are interdependent. We all depend on one another. Every country depends on something from another country. There's no way you say, I have everything. Nobody has everything. I remember one of my colleagues, when I was working in the nursing home, told me openly, look, you have to go back to your country. We don't do that here. We don't say that here. I said, what did I say? It was an issue that a committee had to be said. To ask him, what did I say? I was trying to help a client, and he said, no, that is not how we do it here. Go back to your country. And was effing me all around. So I felt uncomfortable. I said, look, I've worked in different countries, including America and all other countries. I have not faced this much, but no problem. Let's keep working for the sake of our clients. So sometimes people feel that just because you look different, that you are not able to do the job. As a nurse of 35 years, I've got enough experience to do my job. I've trained nurses. I've been a lecturer in the nursing school. I can comfortably do my job. But sometimes when they see you, they say, oh, you don't look like us, or you're not qualified. You don't sound like you know what you are doing. Judgmental, that is not acceptable, especially in the healthcare service, because obviously at the end of the day, we are here for one purpose, and that is our clients. We have to take care of them. They need help. Yeah. So let's work together as a team in the health service to help our patients, help our clients on a daily basis.
There's lots of resources on the DEI hub on HSE land. Maria, do you want to just share a bit of insight into that?
Yeah, so since the team was established, we've been trying to grow the resources that are out there to support staff and managers around all aspects of diversity, not just cultural diversity. On the hub, we've a range of guidance documents and resources on different diversity topics. So related to cultural diversity, we have a guideline on inclusive communications for race and ethnicity, just to give some general principles on what inclusive communication looks like when we're talking about race and ethnic backgrounds. Our team itself is a resource for all staff. So if someone is experiencing issues relating to cultural diversity, or a manager might need some guidance on maybe how to lead a multicultural team and support that team, they can come to us. We recently launched a leading multicultural team program for first-time managers to give them the tools and supports that are required to help manage a multicultural team effectively. So it looks at some of the challenges that managers might be facing now when they're leading a team, but also focus on the benefits that cultural diversity brings to the service user. All this experience coming in is going to lead to better decision making, diverse experiences during creativity, new ways of doing things, new ways of thinking that we haven't thought about before. So it highlights that as well, and some practical tips and advice for managers on how to manage the team. And the network is a huge resource in itself. A lot of the value in the network comes from peer support. So if staff had similar experiences, they're able to share what worked well for them. They're able to connect outside meetings. We also use an MS Teams chat function where members can connect informally outside of network meeting times to give support. We're constantly growing the range of resources that we have available. A key point about the resources is they've all been developed with input from network members. So it's not just the HR team or the diversity, equality and inclusion team writing a guideline on how you communicate around race and ethnicity. We've actually brought in the lived experiences and the insights from people that have those backgrounds. So it really gives a certain authenticity. It just makes the documents and the guidance more real and applicable to staff.
Yeah. It's so important that they're building up those resources and that openness that I kind of called that you mentioned earlier on, Maria. When you have issues like you mentioned, Christopher, that there is sensitivity around this. If we don't address this, there's potential of hurting our own staff.
Yeah, can I just add to that? I know that people do find it hard. There are so many well-meaning and good-intentioned people, and not everyone is inherently racist or would even think themselves of having prejudice or bias. And what I find is that sometimes, like you were saying, Maria, about people maybe being afraid to ask questions if they're curious or to just figure things out a little bit more. There's a very clear distinction between when someone is being judgmental or interrogating, there's a very clear distinction between someone having bias and being prejudiced and someone just being curious. For people to just allow themselves to be that bit more vulnerable, to drop that fear and ask questions if you want. I'm always really open to people asking me questions and being curious, because you can really truly see when someone is actually coming from a good place. And then it's okay. You have a certain level of grace for people if they might say something the wrong way or whatever, because you can see the underlying intention. And I think that's key. If you've good intention and you're just being curious, feel free to be as open as you want. It's important in order to grow, in order to learn. And that's the only way forward, is not having it be a taboo topic. Need to be able to talk about it and to have that, to grow that awareness.
That's very good, if I may come in there, because it's better to ask the wrong question and get an answer than not to ask any question and yet go with your own answer.
Absolutely.
Yeah, very good.
Yeah. If you have a question, ask the question, get the correct answer. Are you from Nigeria? Yes, I am. How do things go around there? I'll tell you. So it's better to ask the question, get the correct answer, than walk around with the wrong answer in your head, thinking that all Nigerians are scammers.
Yes.
Or anybody that is black is not competent.
Yeah.
That is wrong answer. So the more we talk about it, the more we get people to know that, look, there's room for question and answer. I answer a lot of questions, and I'm very happy to do that every day, just to make sure you are comfortable to allow me do my job.
Yeah.
And we become friends. I had people that were really angry with me, telling me to go away. I don't want to talk to you. After 3 months, he came back and he was reading through the messages he sent to me. And then he wrote another message to apologize. 3 months after, I said, I'm sorry for this message that I sent to you. I was very wrong. Shouldn't have said these things to you. You are doing a fantastic job and everything. So when people come to the realization that indeed they have some prejudices or biases that need to be addressed and they didn't address it at that time, let them address it. Ask the question. I answer the question. We keep going.
Can I go back to you related to that point that Christopher was talking about? But you mentioned that when you meet a client face-to-face or a patient and you've been speaking to them on the phone, you built up an initial rapport and understanding, and then you're faced with a barrier again. You can see it in their eyes, and then you have to nearly bend over backwards. I'm just guessing here now that you have to be ultra compassionate and warm to try to build it again. That seems unfair, but is that a reality?
Yeah, it's an additional job on top of the job you're already doing. So as healthcare workers and as caregivers, part of our essence is that we are compassionate and we're empathetic. And part of having that client therapeutic relationship is that you're creating a safe space for the person who sat there in front of you to be able to share in a vulnerable moment. When that person is guarded or doesn't trust you, there's no way to come to the other end and to get the outcome and to really fully deliver that care. I'm very much coming from an allied health professional context where it's not that you're seeing someone one time, but you're seeing them over an episode therapy, and you may have them on your book for years, You need to get over that barrier in order to have successful interactions. And so the only way to do that is to do what makes them more comfortable, which is to lean into your Irishness more. I'm at an advantage that I'm able to do that. So many people are going to have to try and do that and jump through more hoops.
You have more Irish experience.
Yeah, internally, you're reducing yourself. I'm half Sierra Leonean and I'm hugely proud of being half Sierra Leonean. My 2 children both have tribal names as their first names. I have a tribal name as my first name. I want them to know that they have that heritage within them. I'm hugely proud of it. The older I get, the more and more proud I am of that heritage. And my whole life, people would say, oh, where are you from? Are you from Ireland or from Africa? And if people would term me as being Irish, I would always, since being a child, come in, no, I'm half Irish, I'm half Sierra Leonean. Also for my father, I don't want to reduce him either.
Yeah.
Why should I have to reduce myself and reduce my identity in order to make somebody else feel more comfortable? Why should I have to stretch myself in that way? There needs to be an openness that just because somebody does not look like you, does not sound like you, has a different cultural heritage or a different cultural background does not mean that they have no commonality with you. They aren't able to work with you. You won't be able to work with them. We're all humans at the end of the day. We all have shared experiences. It's actually reducing the richness that you can gain. There's such richness in multiculturalism.
Yeah. That's what Maria was talking about, wasn't it? That there's so much there. I just wanted to ask you about a related issue there. It's nearly like we need to be culturally sensitive. Like we, as in white Irish, need to be culturally sensitive, seek that diversity rather than shun it.
Look at any major city. If you look at London, it's a melting pot of people. If someone in London who is black said they're from London, you wouldn't question it. Whereas the same person here, you'd say, but where are you really from?
Yeah. Does that hurt or frustrate you?
Yeah, it's a constant. Or aren't you lucky you've such a tan the whole year round? Or throwaway comments that are jokes. But they layer and layer and layer and layer. And what every single statement like that is saying underneath it all is, you don't belong, you're different, you're not the same as us and them. It's that sort of a perception. The odd time you can brush it off. I don't want people to get the impression that we're hypersensitive. Having that view gaslights or reduces the lived experience day to day. Those little things, those little microaggressions layer up. I've had a situation where I've had to work with someone who was overtly racist and had stated he did not want to work with anyone who was not a white Irish person. And I had to sit in a clinic room with that man and work with him and build rapport with him to be able to care for him.
Oh my God.
It leads to situations like that. And that's the issue. The little things build and build and build, and they chip away at you. And it's very draining. In order to be able to thrive and we talk about having the wealth and the richness of multicultural people working within the workforce, in order to be able to survive that for the lifetime of a career, you have to be so resilient. You have to be so strong in your self-worth and your self-identity. And at different seasons in your life, you're not going to feel that level of strength. But you're always going to have to rebuild that in order to keep on going without burning out.
Wow, that's so
the
strong.
Issue.
On that, an interesting book I read recently, it's called The Culture Map by Erin Meyer. So in a work context, she talks about 8 different work processes. So communication being one, leading, and how we give feedback. Basically what she's done is she's mapped cultures across these 8 work areas. So an example might be some countries might be more direct communicators and the other countries might be less direct. So Irish people, we can sometimes beat around the bush and we're not always to the point.
Yeah.
Whereas other countries, and this is very generalistic, obviously, can get to the point very quickly. And she's done this across those other work processes, like how we give feedback. Is it very direct? Is it constructive? Or is it more straight to the point? It was a nice way of framing it that we're all somewhere on that spectrum. So even if a manager was to map out their team, it just shows that there's such differences in how we approach our work, how we communicate, what our attitudes towards authority are, that we're all somewhere on that spectrum of one end to the other, and there's no right or wrong. So it's just to bring more awareness to the diverse makeup of your team, because it helps you manage it. If you know what your preferences on the team are, if someone maybe speaks in a certain way, if someone likes getting feedback in a particular way, helps a manager navigate that and bring the best out of the team.
The managers are so important here. And I welcome the resources that you named earlier, Maria, guidance for managers on the intercultural teams or the cultural diversity teams. And it kind of speaks to some of what you were saying, Abbie. You were saying, I'm not hypersensitive here, but there are issues that you are sensitive to, and that if you don't take cognizance of, you're going to hurt my feelings here because you're not actually paying attention. So you have a cultural experience and it's diverse. It's unique because you're Irish and you're Sierra Leonean. Christopher, you have a cultural experience and you've got international experience as well. The way that you were telling us that you've worked in so many different countries. So we have to make that a rich asset to the team. That means it has to be aired a bit rather than just kept quiet or we won't deal with it.
Yeah, just to go back to what Maria was talking about, resources for managers. It is very important that managers know how to lead multicultural teams, because if they don't, the team will suffer. And when the team is fractured, then the client or the patient will suffer at the end. Because if the team is not cohesive enough, the team is already multicultural. We have people from different countries in your team, and you are the manager. You are not able to hold the team together, and the team is fractured. Then the care, the quality of care rendered can be affected. I don't know if it's a course on HSE land. Is it mandatory training on HSE land for managers on how to lead multicultural teams? Because this is very important. Our teams are becoming more diverse. And instead of it to be a blessing, a lot of people are seeing it as, oh, it's not very good. But it is good. It's cultural enrichment. Cultural diversity enriches the society, not just in terms of knowledge, but also in terms of skills, transfer. The way things are done in different places is what you bring in to help to improve what is being done. Like Abbie was saying, we will come to a time that we will see that our patients are becoming more diverse. So when our patients are becoming more diverse and the teams working, looking after this patient are equally diverse, then it will be very easy to work together. Sometimes you might meet a patient that needs some help, but you don't know how to help the patient. You remember one of your team members is from the same place from that patient. So how do we deal with this? Some cultures don't look at people in the face to talk. So you have to learn this. So cultural competency comes from cultural enrichment, comes from cultural integration, and then we are competent to deal with them. Because if you talk to somebody and the patient is looking down, because in their culture, they can't look at you in the eyes. Where I come from, a woman should not look at a man in the eyes, like straight on and speak. So sometimes you will see me going down and we are not comfortable calling somebody by their face name. And that is the very first thing I had to learn the hard way. I can't call somebody on the face name. But here we are told you have to call the patient on their face name. So we have to learn how to adapt so that we can do the job. So the people we are doing the job to also need to learn how to adapt so that they can receive the care we give. So it benefits not just the staff, but also the public. So let our managers be trained properly so that they can keep the team in a cohesive manner to deliver the service.
That's exactly what's behind that agenda, isn't it?
Yeah, that program is all about people that are new to managerial roles. So maybe this is the first time they're experiencing the challenges of leading a multicultural team. So it's very much based on practical examples as well. So we go through different cases of things we've seen that have happened maybe in the workplace, and then suggestions on how a manager could approach it and work with the individual or the team. What you said there about it being a two-way thing. So it's not just staff that come to Ireland that are internationally trained adapting to Ireland. It's also people that have trained here and lived here all their life adapting as well. So it's definitely a two-way thing rather than one group having to adapt and no movement on the other side.
Going back to that openness again.
Cultural intelligence, just because someone's a different colour doesn't mean they can't be Irish, doesn't mean they can't be Irish and something else. Doesn't mean they can't have a mixture of ethnicities and heritages, that all complement each other. We can't all just see one thing as one thing. It's a very ignorant way of looking at things, really, to put it bluntly.
Yeah. Cultural intelligence.
Mm.
Yeah. Okay, so we're coming near the end of the podcast. I really appreciate your views and your insights into both the Diversity Network and your own cultural intelligence, as you put it, Abbie. Is there anything you'd like to add before we finish up? Abbie, I'll start with you.
Just for people who are maybe listening and wondering, well, what realistically and practically can we do every day within the Irish context? There's the idea of being an ally. So you don't have to have a person of colour in the room with you to hear bias and to hear prejudice. How are you going to stand up against that when you're in that situation? And I came across something that I thought put it really well. It's called the anatomy of an ally. So allies are people that have a mouth to speak against injustice. They have a nose to sniff out implicit bias. They have eyes to identify privilege, ears to listen to the person of colour experience, hands to take action and make change, and a heart to cultivate empathy for the oppressed. So you can make a difference day to day, even if you're not coming across or with colleagues who are of colour. You can make a difference day to day in your social life as well.
So where's that from?
On LinkedIn. It's being shared a lot of times. I don't know who the original creator is, but I just thought it really encompassed that mindset shift.
That everybody has power.
Absolutely, yeah.
Very good. Christopher?
Yeah, thank you very much. I think the bottom line is Ireland has changed and Ireland will continue to change. We need cultural enrichment to grow our society, and it benefits not just the staff, but also our service users. So it's time that everybody is open, talk about it, ask the question, get the correct answer, and then the service will be delivered. Thank you.
Well done. Thank you. Maria, final thoughts?
Yeah, I'll just signpost maybe to some supports and resources that people might be interested in. So firstly, I mentioned the Diversity, Equality and Inclusion webpage. Lots of information and guidance there for staff, and also the Diversity, Equality and Inclusion hub on HSE land. A lot of information there as well on different topics. Secondly, the Careers Hub has a lot of information now for new staff that are thinking of joining the HSE. So it outlines in a roadmap style the different supports that staff coming to Ireland might need at different stages of their journey. So in their first week, and even before, if they're considering moving to Ireland to join the HSE, the first 3 months, the first 6 months. A simple guidance document for managers to help support staff coming to Ireland to join the HSE. And finally, just if anyone's interested in the Cultural Diversity Network, if you want to find out more or you want to join, you can contact our team on diversity.hr@hse.ie.
Great. Okay. Well, I'd like to thank you, Maria, Christopher, Abbie, for sharing your thoughts and insights from the Cultural Diversity Network today with us. And I'd like to thank all our listeners for their continued support of the podcast. Please share this with somebody you think would get value out of it. And if you want to contact us at the podcast, you can email us at healthandwellbeing.communications@hse.ie. And thank you for listening to another episode of the HSE Talking Health and Wellbeing podcast.